Hello, I'm Dr. Mike Mannheim here at the Grady Veterinary Hospital. I've been asked to speak to you for a moment concerning motion sickness in dogs. Motion sickness is a syndrome in dogs which occurs when they're transported in cars, boats, or airplanes. It's a syndrome that is very well recognized but not very well understood as to what causes it. The thought process is that there is a conflict in the brain between the visual cortex and the inner ear that results in a dog that is nauseated and or vomiting. So emesis or vomiting is the most common clinical sign associated with motion sickness. But there are other signs that I'd like for you to be aware of. And ask yourself, are you seeing these clinical signs in the back seat of your car when your dog jumps in? These clinical signs can include hyperexcitability, drooling, dilated eyes, panting, pacing, licking of the lips, or excessive swallowing. Many people will tell me that their dog just drives them crazy in the car because of those type of behaviors. I'm asking you today to ask yourself, is your dog crazy, or could your dog be suffering from signs of motion sickness? The traditional ways that we managed motion sickness in the past would be over-the-counter drugs used in humans, such as Dramamine. We had very poor success with those drugs. We would also use human anti-vomiting drugs. We would use drugs out of the veterinary hospital that would sedate the pet, which is undesirable because when you reach your destination, you now have a pet that is not particularly functional. There are homeopathic remedies out there on the internet, not very successful, and certainly behavior modification training. The good news is today we have very effective veterinary labeled, tested, and proven drugs for motion sickness. As a matter of fact, we can give an oral medication 2 hours prior to travel and achieve very good motion sickness control for up to 24 hours. So if you're seeing the clinical signs of motion sickness in your pet, ask your veterinarian the next time you're in the Grady Veterinary Hospital and see if we can't manage that clinical sign. Because it's miserable for your pet, and it's inconvenient and certainly heartbreaking for you as a pet owner.